Good morning, everybody. So we'll continue our discussion on phenylalanine metabolism. Yesterday we discussed about the 7 steps which are essential for the formation of fumarate and acetoacetyl-CoA. And in between we have seen 5 disorders which were related to PKU, tyrosinemia type 2, tyrosinemia type 1, tyrosinemia type 3, and then we also discussed about alkaptonuria, isn't it? So today we are going to focus on that particular reaction where you find phenylalanine is an essential amino acid which is converted to tyrosine, and from tyrosine now we are going to convert to fumarate and acetoacetate. So you see here this reaction which we discussed yesterday, we are now concentrating mainly on this particular reaction where you have tyrosine, and by transamination reaction it gives rise to p-hydroxyphenyl pyruvate. Now here is the main enzyme p-hydroxyphenyl pyruvate dioxygenase, which is an ascorbic acid dependent enzyme. So vitamin C dependent enzyme, this dioxygenase, and it converts p-hydroxyphenyl pyruvate to homogentic acid. Okay, so this particular reaction we are going to observe that in case of homogenous acid which is formed so far, it has to convert, and the ring which is, you see the ring, this ring has to be cleaved to give rise to fumaric acid and acetoacetate. Now this particular enzyme homogenous dioxygenase, this particular enzyme is deficient in case of alkaptonuria. So in case of alkaptonuria we are going to see that this particular enzyme which causes dioxygenation is deficient. So homogenous acid is not converted to further reactions which you are going to see in the pathway. So alkaptonuria basically is a deficiency of homogenous acid dioxygenase. Here you expect the oxidation of homogenous acid to alkaptones. Okay, the polymers, the black polymers, the black color pigments which you see in the cartilage, in the soft tissues, and also in the urine samples. Okay. This deposition of alkaptones in the connective tissue, usually which now these are soft connective tissues like external pinna, ears, so all these places is deposits, and this results in onchrosis. Onchronosis is a term where you find the deposition of alkaptone pigments which are coming from homogenous acid. When it gets deposited in these joints, leads to arthritis. Now what happens, how we are diagnosing this type of cases? So we are usually taking the urine sample, and a long standing you see the dark color is formed in the urine sample, and when we do a ferric chloride test or silver nitrate test, it shows positive. Okay, so ferric chloride tests and silver nitrate test we can do in the lab to find out in case of alkaptonuria, but the major one which you find it is that you are going to observe the formation of alkaptones, and which can cause onchrosis. This is the 2 important features which you are going to discuss here, and this onchrosis will lead to arthritis. Okay. Now, this is what we have discussed. Because of the polyphenol oxidase, this homogenous acid is converted to benzoquinone acetate, which further polymerizes to give rise to alkaptones, and these alkaptones will bind to various tissues. Now in case of intervertebral disc or in case of any soft cartilages, when they deposit, they causes malfunctioning of this particular segment. Now here you come across, I have heard that you have heard about this name, Archibald Garrod, who was the first person to detect this inborn errors of metabolism. He was basically a chemical pathologist by profession, and he has contributed a lot in inborn errors of metabolism. His first article was published in Lancet in 1908. See, this is where he published. It was associated with Great Ormond's Hospital for Sick Children, and from here he published the article in Lancet in 1908. And he was the first to talk about alkaptonuria. Okay, so you see the history of alkaptonuria, and he is the one person who contributed in 1902, which he told that it is a disorder of inherited enzyme deficiency. And that's why we started working on this, what are the causes of the various deficiencies of enzymes, and because of that so many disorders which we know till date is because of this particular pioneer. Now in case of homogentic acid, we have already discussed that it is because of the homogentic acid which convert to 4-mallyl acetoacetate, and this particular enzyme we are concentrating because this enzyme is the one which will be deficient in case of alkaptonuria. Okay? So the enzyme properties, you do not worry about that. It's having 448 amino acids, molecular weight is 50,000. There are 21 amino acid residues of histidine and 23 amino acid residues of tyrosine. This we are talking about the enzyme that is homogentic acid dioxygenase. Okay? And the genes is located in chromosome number 3. Okay? So anyway, you just know about homogentic acid dioxygenase because this is the one which we are going to concentrate, and this is the reaction which has to take place, and without this reaction taking place, you can find this homogentic acid is converted to alkaptones, and this will further form deposition of these pigments in the various tissues and soft organs. Okay? Now only one thing which you are going to concentrate is here, the plasma level of homogentic acid. Normally you have 6 micrograms per liter. Okay? In case of alkaptonuria, you are going to observe that it increases to 6 milligrams per deciliter, and also the homogentic acid which is excreted in urine around 6 grams per day. This is what you are going to look around for this. Now this is what you see, this pigmentation you see, these are the pigmentation which you can observe. Okay, these are the pigmentation which you observe in the soft tissues. Okay, and this is the sample, patient sample. You see on long standing what is happening? There is a formation of black color pigments. Okay, so this is the classical case of alkaptonuria. Even in OSPE, we might be asking you a case of alkaptonuria in the short or long essay questions. Now, the mechanism in which this pigmentation takes place, you see the dietary proteins which we take around 100 grams, of which we have 4 grams of phenylalanine and 3 grams of tyrosine. This phenylalanine converts to tyrosine. Tyrosine will form homogentic acid. Now from homogentic acid, the conversion to mallyl acetoacetate and femoral acetoacetate will not take place because this enzyme homogentic acid 1,2-dioxygenase is deficient in case of alkaptonuria. Okay? So these are the polymers. You see homogentic acid when it's not converted, so this will form benzoquinone acetate by polyphenol oxidase which requires copper. So copper is one which requires for the conversion of homogentic acid to benzoquinone acetate, and the enzyme is polyphenol oxidase. This causes, you see, this will causes formation of polymer, and these are the oncotic pigments which will form a chemical and physical bonding with the connective tissues and the macromolecules, which is giving rise to the pigmentation. So this mechanism you may not know, but you must remember about this particular intermediate which is coming from homogentic acid oxidase, and that's benzoquinone acetate. And we also expect you to know at least this enzyme polyphenol oxidase, which is a copper containing enzyme. Okay? So this is what we observe in case of deposition of pigments in the cartilages and soft tissues. Now the clinical features is that you have a dark color urine that we noticed, then you have onchronosis, that means deposition of these pigments in the cartilage in the soft tissue, and also in intervertebral discs or in the joints when it get deposited, it gives you a feature of arthritis. Now here the musculoskeletal problems are there, that means ligament here will be there will be muscular deformation. Cardiovascular risk factor is also there because this will cause fibrosis, calcification. There will be also, you come across genitourinary tract infections like you have renal calculi, prostatic calculi, and renal failure. Okay? Sometimes when it gets deposited in the ears, you will be also come across some symptoms of hearing loss. So these are the features which you are going to see in a patient in the long run who is suffering from alkaptonuria. Now this is what I have been telling you. The specimen was left standing for 15 minutes, shows darkening of the surface due to the oxidation of homogenesic acid. The moment you find the homogenesic acid which is in the surface, that will be exposed to oxygen, causing oxidation of these fragments, leading to a dark color urine formation after 2 hours. So this is what we are doing in the lab actually. We are going to check the urine sample of this patient or of these kids, children who we expect to have a case of alkaptonuria, and we are going to notice entirely these segments of the urine sample will become dark color in 2 hours of long standing. Now this is what we have discussed. Again we are recapitulating it. So you have a phenylalanine amino acid. Yesterday I have discussed about this. Phenylalanine convert to phenylalanine hydroxylase to give rise to tyrosine, which is a non-essential amino acid. You see the hydroxylation of this ring which is coming from phenylalanine hydroxylase. We have also discussed about there are 9 types of phenylketonuria which we noticed yesterday, of which we are going to remember the 5 types of phenylketonuria: type 1, type 2 and type 3. Type 1 is due to phenylalanine hydroxylase as such. Type 2 and type 3 is due to dihydrobiopterin reductase enzyme, which is a coenzyme for phenylalanine hydroxylase. And type 4 and type 5, you see there is a delayed maturation of dihydrobiopterin, and also there is a decreased synthesis. Then you see tyrosine, which is formed from phenylalanine, is converted to phe-hydroxyphenyl pyruvate, and this will be transminated with alpha ketoglutarate. The alpha ketoglutarate is coming from TCA cycle, and this will take up the amino group from tyrosine, giving rise to glutamic acid. Now this tyrosine further becomes p-hydroxy parahydroxyphenyl pyruvic acid or pyruvate. Now further, when the dioxinase reaction takes place, you expect to have homogenesic or homogenesic acid, which will be further undergo deoxygenation to give rise to mallyl acetoacetate, undergo isomerization, giving rise to femoral acetoacetate, and then we have an acetase enzyme which gives rise to fumaric acid and acetoacetate. And this acetoacetate further will be forming acetoacetyl-CoA, and that's why we discussed yesterday that since the product from phenylalanine gives you both acetoacetate and this fumaric acid, it's called as both glucogenic and ketogenic amino acids. So I hope you remember the classical disorders, that is PKU, which I discussed extensively. Then today I have discussed about alkaptonuria. We also see the disorders which are tyrosinemia type 1, type 2 and type 3. So we are mainly focusing our discussions in alkaptonuria and in case of phenylketonuria. Now the other segments which we are going to look about, this is tyrosine formation. We also see the synthesis of catecholamines, and catecholamines are dopamine, epinephrine, norepinephrine, and we also see the synthesis of tyrosine, the melanin from tyrosine. Yesterday I have discussed in case of phenylketonuria. What did we discuss? We saw that when the phenylalanine metabolism, the phenylalanine concentration is higher, it has to take up the various different pathways, isn't it? Now the various different products which are formed from phenylalanine is phenyl pyruvic acid, phenyl lactic acid, phenyl acetyl glutamate, and we are going to observe the concentration of these molecules in urine sample because they are the one which is increased, isn't it? Now here we are observing, because of the increase in phenylalanine concentration, phenylalanine will inhibit tyrosinase enzyme. So tyrosinase enzyme, when it gets inhibited, it will not form melanin, and that's why I told you will see the features of albinism in case of phenylketonuria. So here, as such, when we talk about tyrosine, one of the function of tyrosine is synthesis of melanin, synthesis of thyroid hormone. Okay, so these are catecholamines, that is dopamine, epinephrine, norepinephrine. Now when we talk about catecholamines, basically we have a catechol rings with the amino group. That's why the word catechol amine has come. So here we are noticing one of the main function of tyrosine is formation of formation of dopamine, and further you find the formation of norepinephrine. This will further convert to epinephrine. So in this pathway, this is an important area where you must know, because catecholamines are important products which are formed. Okay, these hormones, epinephrine, norepinephrine. So the first enzyme which we are going to see here is tyrosine hydroxylase. What happens? Tyrosine molecule get hydroxylated to form, see here, to give rise to dihydroxyphenylalanine. Monohydroxyphenylalanine is tyrosine. When further oxidation takes place, it gives rise to dihydroxyphenylalanine, and this particular ring which I was talking about, this particular ring is a catechol ring. This particular ring is a catechol ring. Now this dopa is further get decarboxylated to give rise to dopamine. Now what changes you observe? This carbon dioxide which you see here is vanished. It's not there. So this will give rise to dopamine. Now again further dopamine will get hydroxylated to give rise to norepinephrine. So here you addition of one OH group. See here, this is how you are attaching one OH group. So giving rise to norepinephrine. Further norepinephrine, it will get methylated, and the methylation takes place from where? Methylation takes place from an amino acid which is called as methionine. And methionine, active form of methionine is S-adenosyl methionine. So methionine will get activated only when it forms S-adenosyl methionine, which will further donate one of its methyl group and forms S-adenosyl homocysteine. And this methyl group, when it is transferred to norepinephrine, it becomes epinephrine. So you see the changes here in the structure. You are having an amino group and hydroxy group here. This will be the addition of methyl group coming from S-adenosyl methionine. Okay, so these are the 5, 1, 2, 3, 4. These are the 4-step procedure reactions which you observe. The tyrosine is converted to dihydroxyphenylalanine by oxygenation, giving rise to dihydroxyphenylalanine, which is called as dopa. Dopa will further get decarboxylated to give rise to dopamine. Dopamine will further get hydroxylated to give rise to norepinephrine. Norepinephrine will further get methylated to give rise to epinephrine. Okay. So the another important molecule which we are seeing is melanin formation. This also coming from tyrosine. So tyrosine will get hydroxylated to give rise to dopa. Now from dopa you see what you observe. From dopa you having decarboxylation to give rise to dopamine. But in this reaction you observe dopa is converted to dopaquinone, not dopamine. This is by tyrosinase enzyme. These particular enzyme which we discussed here will be inhibited by phenylalanine, isn't it? This is the enzyme which we are talking about it, because you see the features of you see the features of albinism in case of PKU. So here phenylalanine molecules which is increased, this will inhibit this tyrosinase reactions, so that dopa is not converted to dopaquinone. Now this dopaquinone further, these are highly colored polymeric intermediates which will conjoin to give rise to black polymer pigment, and that is called as melanin. So up to dopa is clear. In the previous reaction you observe, see up to dopa, so tyrosine converted to dopa. Now instead of going to dopa decarboxylase, we are undergoing tyrosinase enzyme activity here in dopa, so that it forms dopaquinone instead of dopamine. Okay. Now this dopaquinone will further get polymerized to give rise to this intermediate, and that is called as melanin. So here melanin formation will take place because of tyrosinase. This is the what you're going to, this particular reaction is important for you, because from here there is a diversion, isn't it? From here there is a diversion. Instead of going to catecholamines, it is now going to form dopaquinone, and further it will polymerize to give rise to melanin pigments. Simplified way, tyrosine by enzyme tyrosinase to give rise to dopa. Dopa will undergo tyrosinase, which gives rise to dopaquinone. This will form indoquinol, and this will form melanin. So melanin formation mainly based on tyrosinase. That's why you observe the formation of dopaquinone. Otherwise, you will observe what? Dopamine, okay, when you undergo decarboxylation. So from there you find the division of the reactions happening from tyrosine. This point, please remember and please check how the diversion takes place. You don't mix up the both reaction here, okay. Again, I am telling you, see, from this particular reaction there is a bifurcation of this pathway. You have to notice whether you are going to go for dopamine synthesis or epinephrine, non-epinephrine, or you are going for melanin. If you are going for melanin, this particular reaction is crucial here, because from here you are going to divert your pathway to tyrosinase enzyme, not to decarboxylase. So this particular step is very critical for regulating, either you are going for melanin formation or going for dopamine. So this reaction, please check it. The previous reaction we have seen, now you see dopa, which convert to dopamine instead of dopaquinone, isn't it? If it is converted to dopaquinone, then you require to have tyrosinase enzyme. This is the point where you told. Now in one reaction you find here, you require vitamin B6. So ascorbic acid is very critical for formation of epinephrine molecules. If you have deficiency of ascorbic acid, then it's obvious that you cannot be synthesizing epinephrine. And the other important reaction we observe with methylation reaction here. The methylation from norepinephrine to epinephrine takes place by SAM, okay? And this particular reaction we'll discuss when we talk about methionine metabolism. We will observe that the transmethylation reaction, there are so many intermediates formed which are useful for us. That is because of transmethylation reactions. And these transmethyl reactions basically takes place from S-adenosyl methionine. Okay. Now again we recapitulate. You see here tyrosine, by tyrosine hydroxylase giving rise to dopa. Dopa decarboxylase will give rise to dopamine. Dopamine hydroxylase will give rise to norepinephrine. Non-epinephrine will further convert to epinephrine by methylation. Further, these epinephrine molecules will further get metabolized by catecholamine or methyltransferase. Again, it requires SAM here. So SAM is donating the methyl group forming S-adenosyl homocysteine, and which is further forming metanephrine. These molecules, metanephrine, vinyl mandelic acid, these are the products or the metabolized product from epinephrine. So when we ask about metabolism, you cannot restrict your reactions up to phenylalanine, but you continue with the discussion with another two steps, that is catecholamine or methyltransferase and monoamine oxidase. So with that, you see the formation of vinyl mandelic acid, and this vinyl mandelic acids are generally is one of the molecule which we are going to see in case when you have pheochromocytoma. We'll discuss about pheochromocytoma. What is pheochromocytoma? In case of pheochromocytoma, we observe the increased excretion of vinyl mandelic acid. This is what the molecule which we talk about in pheochromocytoma. Okay. Now, other thing which we discussed, we noticed is that these tyrosine molecules will also form thyroid hormone. So it can be either, which is this carbon number 1, 2, 3. So at third carbon there is iodination. So this is 3-monoiodotyrosine. This particular pigment is nothing but tyrosine, if you see. Now I am iodonating at carbon number 3 with 1 iodine. So that's why it's called as monoiodotyrosine. If you iodinate with the 3 and 5 carbon number, it becomes 3,5-diiodotyrosine. So this will become monoiodotyrosine, this will become diiodotyrosine. And if you add up this MIT with DIT, what will you expect to have? It will give rise to 3T3. Similarly, if you take 2 molecules of DIT and 2 molecules of DIT, you are going to get T4. So it depends on the number of carbon which are getting iodinated. That is what we notice here. So this is T3. You have at the 3rd carbon, at the 5th carbon, and at the 3' carbon. Now 3' carbon, when we talk, it is the ring which is placed apart. Okay? So this is 3', this is 5', this is 3, this is 5. So this you see, if you have iodination at the 3 carbon, at the 5th carbon and the 3' carbon, it will give rise to molecule formation of T3. Similarly, if you iodinate 3, 5, 3' and 5', you are going to get T4. Now the question is, when we talk about reverse T3, have you heard of reverse T3? What is reverse T3? In reverse T3, you expect the iodination not in these 2 carbon, but in this and this carbon. And there will be a single iodination in this proximal ring. So that will give rise to formation of reverse T3. So now we just recapitulate what we have discussed in today's session of class. We have discussed so many things now, you see. We just try to recollect one by one and we'll wind up our discussion for today's session. So we started our discussion with homogenetic acid formation. We saw that homogenetic acid is formed by tyrosine by transamination reaction, which is giving rise to p-hydroxyphenyl pyruvate. P-hydroxyphenyl pyruvate will further undergo dioxygenase by another molecule of an important molecule, that is ascorbic acid dependent reaction. This dioxygenase is ascorbic acid dependent reaction, which is giving rise to homogenetic acid. This will further undergo dioxygenation to give rise to fumarate and acetoacetate. And this homogenetic dioxygenase is the enzyme which is deficient in case of alkaptonuria. So this is what we have started our discussion with. Then we talked about the various features of alkaptonuria. We mainly discussed our focused attention on dioxygenase. Homogenetic acid is converted to alkaptones, and these alkaptones will further deposited in the connective tissues, resulting in onchronosis. Okay? And this will further cause arthritis. Now I discussed about these changes in the color of urine on long standing, that was a dark color urine. We also seen the test will be positive with ferric chloride and silver nitrate. Now I have shown you here the polyphenol oxidase reaction, which is important one. So homogenetic acid is converted to benzoquinone acetate. This will further get polymerized to give rise to alkaptones, and this will get deposited in the soft tissues and cartilages. This was the man who was published, Archibald Garold, okay, and because of that only we know so much about inborn errors, and he was published his article in 1902. Here we discussed about the different enzymes and the enzymes properties, that you need not worry about that. You must think about this dioxygenase reaction, because this is the important reaction in case of alkaptonuria. Okay. If you can, you remember the normal concentration of homogeneous acid in the urine, and also in case of alkaptonuria, it's almost 100 times increase. That's why it's focusing. You have to remember. You can also see the force of increase of homogeneous acid in case of alkaptonuria. Then further, I told you the deposition of these pigments, the onchronosis in the external pinna, the soft tissues, the cartilages, and all these places. And I told you the long-standing urine will give you a dark brown color upon exposure to atmospheric oxygen, where it gets oxidized. Okay. This is the mechanism of formation of pigments we have seen here. And I told you to remember here one important molecule or one homogeneous acid. And this enzyme I told you to consider, that's polyphenol oxidase, and also it requires copper. Okay, so these two important reactions you must remember, which give rise to formation of polymer, that is oncotic pigments, and these oncotic pigments will further give a chemical bonding and a physical bonding, giving rise to macromolecules connective tissues. And these are the features I discussed about alkaptonuria. You can see a dark color urine, you can see onchronosis, you can also see the features of arthritis, and also I told you the various musculoskeletal disorders, cardiovascular disorders, genital infections, and hearing loss in case of alkaptonuria. So these features is important for you to remember. This is what we have told you, that in long-standing urine for around 2 hours, the entire urine will become black in the initial stages. You see, when the exposure of oxygen is there in the initial segments, these areas will get black or darkening of this, and further it will precipitate or further it will aggravate and give rise to the whole segment will be urination. So this pathway, again you see in this pathway there are 5 disorders, 5 enzymes. So you must remember this pathway, so it's easy for you to recollect in case of phenylketonuria when question is asked, or in case of alkaptonuria if question is asked, so that you can cover up the entire flow chart from here. Okay, there are other reactions which I discussed about formation of catecholamines from tyrosine. Then I also discussed about melanin formation from tyrosine. Then I discussed about the formation of epinephrine, non-epinephrine. I told you to see the important reaction here, that is SAMP, the methyl donor in case of non-epinephrine conversion to epinephrine. Then I told you to remember about catecholamine or methyl transferase, another important reaction which will further get metabolized to vinyl mandelic acid, and this will be argentinous cells. See the formation of, in pheochromocytoma, basically you see adrenal medulla, the cancers of adrenal medullary gland, you are going to estimate the increased concentration of valine mandelic acid. Then further, and lastly, I discussed about one of the another important features of tyrosine is the formation of thyroid hormones, and this is what we see notification. When you iodinate in the 3 carbon, it becomes 3 monoiodotyrosine. When you iodinate 3 and 5 carbon, it becomes 3,5-diiodotyrosine. So when one carbon is getting iodinated, that's why it's called as MIT. When 2 carbon is getting iodinated, it becomes DIT. Further, you expect to have MIT will further add with the DIT to give rise to T3, and 2 DIT molecules will give rise to T4. And then I also told about reverse T3. It is nothing but instead of having the iodination at this particular ring, you expect to have iodination at this particular ring. And T3 is important metabolic hormone. So in case of illness, what happens? You want to decrease energy expenditure. In that case, you expect that the body will form more of reverse T3, not of T3. So that's why it's important here. So with that, we wind our discussion. I will give you the assignment once we complete the entire amino acid metabolism. Thank you so much.